Now that we have a basic understanding of how the MAP process works, let's see how it relates to the 10 essential services of public health. The next section will give you a brief overview of the 10 essential services of public health. This wheel shows the 10 essential services. To better understand what public health does, the public health profession in the mid-1990s expanded on the 3 core functions by describing what are now called the 10 essential public health services. All of these services are linked to the 3 core functions. This expansion helped to better define public health. The essential services that constitute assessment are: monitor health status, diagnose and investigate. The essential services that constitute policy development are: inform, educate, and empower, mobilize community partnerships, develop policies. The essential services that constitute assurance are: enforce laws, link to and provide care, assure competent workforce, evaluate. Finally, research is an essential service that looks for new and innovative solutions to health problems and can involve all of the other essential services. Let's look at all the activities that fall under each of the 10 essential services. We will start with the essential services that fall under the core function of assessment. Public health monitors health status to identify and solve community health problems. Examples of how DHEC and others in the public health system monitor health status include the following activities: diagnose community's health status, identify threats to health and assess needs, collect, analyze, and publish information about access, utilization, costs, and outcomes of personal health services, collect and analyze vital statistics and health status of higher risk groups, birth and death certificates, immunization registries, integrate information systems with private providers and health benefit plans. Public health diagnoses and investigates health problems and health hazards in the community. Examples of how DHEC and others in the public health system diagnose and investigate health problems include the following activities: identify emerging health threats to discover, for example, the source of a foodborne illness outbreak. Use modern laboratory technology to conduct rapid screening and high-volume testing. Use active surveillance programs to address infectious diseases epidemiologically. Maintain technical capacities to undertake epidemiologic investigations of disease outbreaks and to examine patterns of chronic disease and injury. Public health informs, educates, and empowers people about health issues. Examples of how DHEC and others in the public health system inform, educate, and empower the citizens include the following activities: market community health issues, communicate to targeted media, provide access to health information resources at community levels, collaborate with personal health care providers to reinforce health promotion messages and programs, participate in joint health education programs, collaborate with schools, churches, and work sites. Public health mobilizes community partnerships to identify and solve health problems. Examples of how DHEC and others in the public health system mobilize community partnerships include the following activities: convene and facilitate community groups and associations, including those not typically considered to be health-related, to define preventive, screening, rehabilitative, and support programs. Build community health coalitions, drawing upon the full range of human and financial resources available.